Thank you for taking time to watch this video today. We want to increase understanding of the issue of heroin and other opioids use so that we can come together to take action for our community. Today, we will discuss three aspects of this issue. First, we'll talk about what opioids are, how they are abused, and how they affect the brain and body. We'll talk about the size of the problem and how it got so big. Third, we'll ask what we can do as family members and as members of a community. To be clear, there are no easy answers or immediate solutions to the problem. However, there is important work we can do to save lives and reduce use and addiction. You or someone you know may have been personally affected by heroin or opioid use. For others, the opioid epidemic is something heard about on the news. Let's begin by watching a video that starts to communicate the scope of this problem.
The United States of America is writing a prescription for pain that is wiping young people like me off the map. Our addiction to legally prescribed pain pills, like oxycodone or hydrocodone, is leading a lot of us straight to heroin. That's because prescription painkillers and heroin are both opioids. So when we can't get a refill, heroin is the only way to stop our pain or to get the same high. And heroin's less expensive and easier to get. I can have black tar heroin delivered to my house faster than a pizza. Once we start, we have to keep using, not for the high, but because we get sick from withdrawal if we try to stop. It's an epidemic. We're rich, poor, and middle class. We're from farms, cities, and suburbs. We're from families who had big hopes that we'd live healthy lives and not fall so far from such a high.
Let's take a closer look at opioids. Specifically, what are they? Opioids are chemicals that are either produced from the opium poppy plant or created synthetically in a laboratory to have the same effects. Some are produced legally, and some are not. The lab shown here was busted for illicit fentanyl production in Canada. Some opioids are medicines, others are medicines that are produced illicitly, and some are illegal drugs. The important point here is that they are all very similar at the molecular level and have very similar effects on the human body. Opioids are used and abused in a number of ways. When swallowed, they are broken down by the stomach and take longer to reach the brain. Powdered heroin or pills can be inhaled through the nose. Heroin can be heated, and the vapor is inhaled through the mouth. Heroin can be added to a liquid, heated, and then injected directly into the bloodstream. Opioid injection is especially risky for a number of reasons. Shared needles lead to the spread of HIV/AIDS and hepatitis C. Needles can damage veins and cause abscesses. This damage may lead to bacterial infection of the blood and heart problems. People use needles because it delivers the drug to the brain much faster than any other ways of using. Opioid users never know what they're going to get because drugs that are sold as heroin may be fentanyl or something else. Fentanyl, which is 25 to 40 times as powerful as heroin, is driving overdoses from users who think that they are buying and using heroin, but they are actually getting something much more potent. Illicit fentanyl use is definitely on the rise. This chart from the National Forensic Laboratory System shows how these numbers have grown over the last decade. Opioids are even more dangerous when consumed with other drugs. Alcohol and sedatives compound the depressive effect of opioids. Stimulants, such as methamphetamines and cocaine, do not balance out the heart and lungs. They throw them into chaos. This reinforces the point that people don't really know what they're getting. There are many reasons a person may start using opioids. Every person's story is different, and these reasons overlap. One person may get a prescription and then misuse their medication by taking more than they should, or taking it in a way they shouldn't, for example, with alcohol or more frequently than prescribed. Another person may start using pain pills they were prescribed, then develop a tolerance and increase the amount that they're using, or start using pills in a different way. Many people use opioids to cope with emotional stress, pain, or an untreated mental health issue. The shorthand for this is self-medicating. For others, opioids are simply a way to get high. People continue to use opioids because the body develops a tolerance to use, and users need more and more of the drug to get high. Eventually, they don't even get high when they use because their body has adjusted to having excess opioids in their system. What keeps people using is fear of withdrawal. Withdrawal has been described as 100 times worse than the worst flu you've ever had. If a user gets through physical withdrawal, they may experience emotional withdrawal, missing the feeling of being high. This can lead to relapse, which means that a user starts using again. Relapse is dangerous because a user may go back to using the same dosage they did prior to when they stop using, but their body is not ready for it. Relapse can result in overdose and death. In this video, a young man, Nacho, discusses the ways in which addiction affected his life.
I had gone through tons of withdrawals, times where, you're sick, it feels like 1,000 times worse than the flu, you're sweaty, you're trying to get through anything. I would walk into class, in these withdrawals, and I would go through this horrible week, and, never gonna do this again. And 2 days later, I had already made it through the acute withdrawals, but I was using again, and knowing full well that I'm gonna have to go through that again at some point. I wish I knew really what these prescription pills were. These are all synthetic forms of heroin.
Know the signs that can indicate an overdose. Opioids affect the heart and lungs. As they slow down and weaken, the entire body can be affected. Blood carries less oxygen, which affects everything from skin color to responsiveness. Erratic breathing leads to choking sounds, which are appropriately called a death rattle, that can sound like snoring or choking. If you encounter a person who is experiencing these effects, the first thing to do is call 911. It is important to note that while naloxone, also known as Narcan, can reverse an overdose, the problem remains. Reversing an overdose can be a step towards getting a loved one into treatment. In the next video, we will look at how big the opioid problem is in our communities.